Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also podcasting now, so you can catch us on any of the podcasting apps. We ask you to download us, like us, please review us, and recommend us. So if this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here at Health Futures, noon every Friday. And it's not to me, it's to these extraordinary guests that I get to come to the show. So today's no different. I've got in the studio a friend of mine. I'm so glad that we ran into each other the other night, and I had this opening that I could fill it with somebody of your stature. So Todd Larson from HonorHealth, welcome to Health Futures.
Well, thank you. Really, really thankful to be here. It's Friday, and happy to have a great conversation today.
Well, I'm happy to have you here in the studio. I met you a few years back when you were heading up the military partnership for HonorHealth. And, before we do a deep dive into even that program and the other program that now you're working on at HonorHealth, I would like our listeners, and for me too, to learn a little bit about Todd Larson. I don't know if you're from Arizona, but just a little bit about your background and how your journey took you to where you're at today.
Yeah, no, thankful for the question and for the time, so really appreciate the time to be here. Yeah. HonorHealth is an amazing place, but how I got here, out of high school, joined the United States military, was in the National Guard through the Army. And we're going to talk a little bit about technology today. So my job no longer exists in the United States military because of technology. I was a field artillery surveyor. And then, in the early 90s, mid 90s, as technology was evolving, they had this thing called GPS. So my job actually no longer exists. So it'll be interesting to talk about technology today because the job I did in the military no longer exists because they don't need guys to go out and use survey equipment anymore, right? You have technology, you have things like that. So after the military, I wanted to be a police officer. It's what I wanted to do my whole life growing up. It was not a decision, right? That was what I always wanted to do. And in the very early 1990s, 91, 92, very few jobs in the state of Minnesota. That's where I'm from, born and raised. I'm born in Duluth, Minnesota. Very few jobs. And Arizona was growth. Arizona was opportunity. And so in March of 1993, I was hired and started with the Scottsdale Police Department right here in Arizona. And that's how I came to Arizona. And let's be honest, I mean, could I have been any luckier in life than to come to Scottsdale, Arizona to be a police officer?
Especially from Duluth, Minnesota.
Well, the funny question was, at the time I was dating my wife, and I said, I have this job opportunity in Scottsdale. We ought to just get married and go. And so I still don't know, did she marry me or did she marry the weather? I don't know. But,
how many years now?
32 years.
32 years. There
so
you go.
We moved to Arizona. I started my career with Scottsdale Police Department, as I said. Worked my whole career there. This is how I ended up in healthcare. because, Bob, you and I were talking earlier, and I never really realized how much of being a police officer is healthcare, right?
Yeah.
You talk about the things we're going to talk about in this show, but, aging in place, chronic disease management, elder care, and then you start, trauma medicine, the things that cops do, but then you start thinking about behavioral health and addiction and polydrug, and you really realize you're a caregiver. And I think if you look at it, who are the best cops you ever worked with? They were actually caregivers.
No, I love how you frame that. And it's interesting. You talk about behavioral health, and I want to just pull this tab down for a second
Sure.
and talk to you about it. And that is, I had the opportunity to serve on the Governor's Advisory Council on Aging for 4 years, appointed by Governor Doug Ducey. And, the number one thing we were working on was dementia and Alzheimer's. And we were working on really educating our community and first responders.
Yeah.
Because there's such a thing, and I know you now in the healthcare vertical, maybe you didn't know it back when you were a police officer, and what happens with dementia and Alzheimer's patients when they sundown, which is usually, late in the day, and there can be major domestic relation issues that come up, and you guys as first responders come to. Do you recall any of that, like back in the day when you were doing this?
Yes. Sometimes those are heartbreaking calls, right?
Yes.
You know that there's no intent, right? Often, there's not someone that wants to cause a problem.
Right. They have a brain disease.
Exactly.
Yes.
And I think that's one of the biggest struggles for law enforcement is how do we help those that we don't have a means to help. One of the greatest, to your point, with Alzheimer's, with aging related issues, I just want to give a quick plug for something that I once saw at Scottsdale Police, telling you the absolute heart of the agency. So when I was a sergeant, I get a phone call, and it was Lowe's and or one of the stores. It could have been Home Depot. I don't remember. It's been 20 years, but Lowe's or Home Depot. And it was a conversation they had with me about one of my officers. And I'm confused. I don't know what this is about. And so as I dig into it, well, what it was is these officers had gone on a call of an elderly lady. Her fridge was no longer working. She was having some issues with her temperature control, and these two police officers from Scottsdale, on their own, they don't call their boss, on their own, they get a hold of it, and I can't remember, like I said, which chain it was, but one of them.
I got chills. I know where you're going with this.
They get a hold of the chain. They somehow get routed to the foundation for that chain, like the nonprofit and the foundation of that, and they have a fridge donated and delivered, and they install this fridge.
I have chills. Wow.
And so nobody hears those stories about police officers.
Right.
Nobody hears those things. So yes, when you think about Alzheimer's, when you think about chronic disease management, when you think about aging in place issues, some of those are just heartbreaking calls, right? Going on these calls and how am I going to communicate? And then you may or may not have direct immediate resources, right? This might be an ongoing.
And that's what we were doing. We were teaching first responders on how to de-escalate these issues, these escalations that were happening because the person has a brain disease. And, it's the things I've learned, and I'm sure you've learned as well, is you have to validate one's feelings before you start redirecting them. And these feelings are real to them. And it's hard, if you're not a practitioner, that. So we have to be able to teach our first responders on how to be able to do that, because they could further escalate a situation that could have been de-escalated rather easily if we'd given them the tools.
Right. And, whether it's finding someone's comfort space, what is what is it that can help them, avoiding trigger type situations.
Right.
All of those things are critically important. And there's probably more training in that area now because, as we were talking, I've been retired for over 10 years and went into healthcare. So I think the training is better now. But again, when you think about it, everybody wants to, our age group, Bob, right? We look back at shows like Chips and, and all of the things we would think about running around on the street and chasing bad guys and all that. Dragnet, and
Mannix, Barnaby Jones,
and, Columbo and all of these things, right? We think about, streets of San Francisco and chasing cars and driving fast. And
that doesn't happen?
It happens, but that's not the core of the job.
Right.
The core of the job is actually people, right? And being that fabric within the community, right? That our job, really the ultimate job is to, you think about life, liberty, and the pursuit of happiness in our United States Constitution and who we are. That's really the job of a police officer, right? The fabric of the community. So, and that's how I ended up in healthcare, is that Scottsdale excels at that.
Right.
And with the Family Advocacy Center, my last role was a dual position where I was the director of the Family Advocacy Center and doing dual duty of that and law enforcement on these investigations that involved people.
That's a great pause for right now. And it's hard to believe we're down our first segment. And, I'm glad we talked a little bit about your experience with the Scottsdale Police Department. And I love how you talked about how the officers that work there are in healthcare. And it makes a lot of sense. And a lot of people don't even realize and think about that. But I want to talk about the family advocacy work that you were doing in HonorHealth and pick up on where your journey is taking you from there. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Todd Larson here in the studio with me. He's with HonorHealth. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I've got Todd Larson here from HonorHealth. And if you missed that first segment, you'll want to catch that because we're really catching up on Todd and really learning a lot about his background, which really has been a purposeful journey to where he is at today. If you want to learn more about it, go to cypresshomecare.com, click on the media button right below its radio show. So, Todd, when we left off in the first segment, we were talking about your journey going from working for the City of Scottsdale Police Department over to working on community partnerships and family advocate work at HonorHealth. Can you share a little bit more about this?
Yeah, so the city was a pioneer in this many years ago, I think 2004, somewhere right around there. So let's just call it 20 years.
Okay.
With this Family Advocacy Center model where you take a multidisciplinary approach, right? We were talking in the first segment about, law enforcement really isn't just law enforcement, right? It's really about people. And the city realized that. And to have a partner, HonorHealth, prior to that, Scottsdale Healthcare, partnering with the city in this Family Advocacy Center model where you would have a multidiscipline array of services, healthcare, behavioral health type, issues with the police crisis intervention team. Those are all licensed master's level degrees, social and counselors. You have investigators, you have community partners. So you have all of these roles in the same building. So you think about if you're a victim of a crime, everybody is there. You have medical care, you have counseling and help and crisis intervention, you have the investigators, and they can communicate, right? So
important. Yeah.
So you can have the healthcare worker having a conversation with the investigator, with the detective saying, I think you're dealing with X or you're dealing with Y, and these are the types of injuries we see. I don't know that this is related to this incident. I think this might be long-term trauma or this might be ongoing. I mean, those are just little examples. But the key is I want to think about that multidiscipline approach. And that's how I ended up in healthcare when working with HonorHealth so much through their forensic nursing program that is at the Family Advocacy Center. Developed relationships. You always have relationships in law enforcement with hospitals, right? You're in and out of them.
Right.
I mean, I felt like we were siblings anyway. And that's how I ended up at HonorHealth, was just working so much with their medical team that when an opportunity arose, I think when doors open in life, you need to go through them and right, take that opportunity.
100%.
So that's how I ended up at HonorHealth, and for the last 10 years, blown away by the organization, the people, the leadership. Whether it's Todd Laporte at the top, who honestly is maybe one of the greatest people I've ever met. I mean, just truly an amazing person.
I agree. He sat in that chair a couple times with me.
Yeah.
Great human.
All the way down to anybody in the organization, right? And so with technology, I run a program called the Health Pass Internship, where we bring technology leaders from around the country in. And the greatest comment we get over and over and over isn't about healthcare. It is, but it isn't. It's, you guys have an amazing culture. That's what's said over and over, right? That the culture that comes through, right? So when people at HonorHealth say, we put the patient at the center of everything we do, and then you have people from other organizations coming saying, wow, I want to work here. Like, your culture is unreal.
But I think that
sets the tone.
But I think you're right. It starts at the top. I mean, because Todd just exudes that. I mean, the fact that he embraced the whole Blue Zone concept,
right,
and the way he did that. I mean, he brought that here to the city of Scottsdale. They couldn't do it without HonorHealth. Yeah,
and when I was in community relations at HonorHealth, when we had military partnership, a bunch of those other roles, I remember Todd recommending the book Blue Zones, and that's 7-8 years ago. Now it's pre-COVID for sure, right? Everything in life now is you don't think in years. It's pre-COVID, post-COVID, right?
Exactly.
So, but yeah, so that solidified to me mindset over matter, right? And that where are we going to go, not what are we doing now?
Right. So these community programs that you've been a part of, and you and I met with the military partnership, before we go on to what you're doing, and I want to spend the entire second half about doing that, can you just give our listeners, because HonorHealth isn't just these hospitals that we see and the ones that exist and have existed for a while. And by the way, I went by Shea the other day, HonorHealth Shea. I just was like, well, there we go again.
Right.
We're growing. We're building, and they're building some new hospitals. Beyond that, they're doing a lot of other things in the community. And you mentioned one being the military partnership, but I would love for you to talk a little bit about those programs.
Sure. HonorHealth focuses on their mission of being a community-based hospital system, and that's important, right? There are lots of community-based hospitals out there. I don't know that they all embrace it the way HonorHealth embraces it, meaning we are here to serve the community. And when you think about their community programs, they start with, well, if we have healthy people, then we don't need the healthcare volumes to be at the level they're at. So in essence, if we can focus on having a healthy community, then there's less need for us, right? And I mean that need from acute high-level care, right? Because we can get things handled in your everyday life. We want you to be healthy. Mm-hmm. So HonorHealth focuses on community programs all the way throughout the fabric of the community. So when you think about, we mentioned military partnership and training the military and military personnel so that they can learn in a top, level 1 trauma center such as the Osborne campus, all the way over to, backpacks for school, going back to school, or you think of Desert Mission in the food bank and the things that we're doing over there. And then you start thinking about all of our volunteer work through our ambassador program, but embracing the community, because the reality is it's a community-based hospital. So if we have community-based programs, we're going to have the healthiest community.
It's interesting. When the Affordable Care Act came out, I sat down with Todd Laporte. I believe he was the CFO at the time. and he drew up on a piece of paper for me, and he drew it backwards. I don't know if you've ever sat in his office, but he drew boxes, so I could see him. He was really good at it. And he tried to explain to me how the hospital will make more money if we can keep people from coming here. And I was like, I don't understand, Todd. Explain it to me. And, this whole community partnership and the community build out that you've shared really defines that. And it is amazing, because you think that you'd make more money if there are more people going to the hospital. And he was like, no, we make more money keeping people out of the hospital.
Yeah, we'd much rather that you're healthy and part of our community than having to come to our hospital for care. I want you to be at home where you're comfortable,
Be
where
with
you're
your
happy,
family.
be with your family.
Exactly. Well, listen, they go by fast. We're down our second segment. We're at halftime here, but the second half, Todd, I want to really spend on talking about what you're doing now. You've got this innovation lab that is doing a lot as it relates to care and care innovation. That's the stuff that I love and I want to share with our listeners. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We're at halftime here. I've got Todd Larson here in the studio with HonorHealth. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. If you're just tuning in, we're in our second half here, and I've got Todd Larson here in the studio with me. He's with HonorHealth. And if you missed that first half, which was an extraordinary first half, you want to go up to our website at cypresshomecare.com, click on the media button right below its radio show. You'll catch this one and many, many more. So, Todd, you've taken us on your journey, and you've taken us through all your experiences. And now here you are with HonorHealth, and you are now in a partnership, or you're in a position where you are leading the innovation lab, and it's a partnership with a company called CDW, which I forget what the acronym is, but I know you'll share it with us. And they probably have evolved from their very beginnings, like all of us have. And I would love to hear the work you're doing, because I talk about this stuff here on the show all the time. And for our listeners who haven't heard me say this before, just real quickly, our 65-year-old population's doubling between now and 2050. Our 85-year-old population is going to nearly quadruple between now and 2050. And by the way, Todd and I are close to the same age. He will tell you that we're aging a lot different than our parents were and our grandparents are. So I'm not so worried about the 65-year-olds. It's the 85-year-olds that are going to put huge pressure on the healthcare system. And just so people understand this, there are 345 million Americans that live in this country. And in order to sustain this population, every child-rearing female needs to have 2.1 kids, and we're now at 1.63 and declining. So the number of people out there aren't there to be able to provide the care. And by the way, another not known statistic, or at least not readily known, is that women have a 2x chance of getting dementia and Alzheimer's versus men. And I'm in the caregiving space, and that caregiving space is dominated by women, not men. So we've got our work cut out for us. And, it's innovation that's going to take us to the next level. And I've learned a long time ago, in order to innovate, you have to collaborate. And I think HonorHealth has got some great collaboration partnerships. And I am sitting here with bated breath, waiting to hear what you have to say about what HonorHealth is doing.
Yeah, so we are collaborating. I think that's a great word to use. including the HonorHealth Foundation. So I do need to mention a lot of this is possible because HonorHealth has an amazing foundation. And the foundation has been our primary partner along with our collaborating group. So CDW, back in the day, Computer Distribution Warehouse. Now CDW is just CDW, a large company, technology products, but they have a fairly sizable strategic group. So we work with the strategy team and the innovation team. And a few years ago, they were going through the Health Pass internship program that I brought up. Mm-hmm. And they approached us and said, look, we think HonorHealth has an amazing culture. We work with several thousand hospitals across the United States. And what you have here is special. We have an innovation transformation center in California. Why don't you come check it out? So I went and checked it out, and at the time, myself, the chief technology officer, and the head of emergency management, the three of us, we flew out there, and we saw it. And they had all these crazy medical gadgets, right? Stay-at-home gadgets or remote patient monitoring and wireless monitoring and all of these various things going on. And we quickly realized, okay, this is really cool, but this is kind of like above our heads. Like, we need more help on this. Circle back to HonorHealth. CDW comes and does a large presentation. We mentioned Todd earlier. He was there. Several others were there. And it was formed. And it was formed because we realized everything you went through earlier, Bob, spot on, right? Do we even physically have the caregivers that are going to be able to handle this task?
Right.
And where's the space to do it? Where are they going to live? All of these factors, right?
And one thing I left off is that 1/3 of our population, 65 and older, is solo aging.
Right.
They don't have family here.
Right. And those that have done it, having, my wife having help with this a few years ago, it can be exhaustive, right? And people don't understand that you have a loved one, you love them deeply, you care for them. But, if you're, say, 53, 54 years old and you're still working a lot of hours yourself, and then you've still got your own children and you've got your own family, and then you're doing this caregiver role for a parent or an aunt or an uncle, I don't know that everyone, if you haven't experienced it, it is exhaustive. And so that's what spawned this whole relationship conversation was, number one, it's two-factored. Number one, what are we going to do in the future because we probably can't care for all of these people at the level we want to care for them for. But through technology, can that care take place in the home? Or can we partner with other long-term care facilities, specialized places, and partner in those roles? And then thirdly was, how can we do this? Because you brought up the staffing issue. Workforce efficiency, teams working together, using technology so that we can have a workforce that's providing really good care but doing it efficiently and allowing us to provide the best care for our patients because we're getting the best work out of our staff so they don't burn out. And we're using technology to tell us things. So we're working on primarily 3 major focuses at the lab right now. One major focus is that whole patient care, which is at the center of everything we do, but that patient care tied with workforce efficiency. What is the emerging technologies that we can use in that? And that those things tie to home health, chronic disease management, all of those things in the future. Because if we can help a patient so that they can either get well at home or, as we brought up earlier, stay well and be healthy at home, then we're actually circling right back to problem number 1 of workforce efficiency and patient care tied together. So these are all symbiotic. Mm-hmm. And we're spending a lot of time looking at technology that we're going to use in our setting, but we could use in the home healthcare setting as well. Or things that could be take-home devices.
Right. Absolutely. Because let's face it. I mean, home is the center of care. And when we look at a future that is as daunting as I've shared, I mean, we can't build enough hospitals.
No.
And I think that's what brings me back to, leadership and Todd Laporte, your CEO, and embracing blue zones and trying to have the community be healthier. Because if we have a healthier community, we all thrive together.
Yeah. I mean, if it's your mother, say, wouldn't you rather she's eating a healthy meal at home? And if there's certain things that she needs to be monitored on, that you could just monitor that through technology while she is comfortable in her home.
Right.
And keeping the space. You and I are at an age, Bob, where we remember when visiting hours were incredibly strict in hospitals, right?
Yeah, they were.
Let's say 8 p.m., pretty common time. It's basically 8 p.m., you need to leave and go home, sir.
Right.
Right? And it's not an insult, that's just the way it was. Until they really realized that if I'm ill in the hospital and I'm in my bed and I roll over at 2 a.m. and my wife is there and she just holds my hand, how absolutely changing that is in the healing process.
100%.
And you think about it in a way, they started realizing, let's let the home into the hospital room. Well, now we need to think about how do we take the care and put it in the home without having to break the bank, so to speak, right? Because let's be honest, right? These are sometimes, if you have a family member that needs that health care, that can be quite draining on families and expensive. So let's back to workforce efficiency. Now we're thinking about how can you be efficient with your family, but yet provide the greatest care. So, what if one of the things we have in the lab, we have our home health room with very smart equipment. So a smart bed, a smart toilet, a smart chair, a smart fridge, a smart stove. And these are technology items. But if you add up the math on purchasing those items, it's a fraction of what you would spend for an in-care facility for a year. 100%. Or it could delay it, say, 5 years.
Right.
And you at home, Bob, could look up and say, okay, Mom, you're supposed to take your medicine, but it's a simple sensor on your fridge. You didn't open your fridge today, Mom. That simple.
It's really, really awesome. I mean, this is like science fiction coming to life. You used a word, I think it was earlier in our show, maybe it was before we even got started, talking about transformational. And I really want to dig into that in this last segment. I want to talk about how transformational a lot of this innovation is going to be for the future. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Todd Larson here in the studio. We're down 3. We got one more to go. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our 4th segment here, and I've got Todd Larson here in the studio with me. He's with HonorHealth, and we've learned a lot about, in that 3rd segment, the innovation lab and all the stuff that they're doing and the collaboration and the partnerships. And the way I left off that 3rd segment, I wanted to really dig into about transformational, and that was something you said at the very, very beginning, because the work you guys are doing is transformational, and it is changing lives. And if we could dig into that a little bit, I would really appreciate that, not only for me, but for our listeners.
Yeah, a lot of people like to throw around the word innovation because it's a cool sounding thing, right? I'm innovating, I'm innovative, and while it is, we're really focused on transformation and being transformational, because if I can take existing products and existing models that maybe they're innovative or they're emerging or they're new on the market, but we can bring them in and we can transform your care. So an example would be something that's a very hot topic in healthcare right now, which is ambient technology, ambient listening. If I'm a nurse, and this would be, in facilities like you have, Bob, or in acute care facilities, it's irrelevant. But the key is, what if I'm a nurse and I can voice what I'm doing, and I don't have to turn my back to you to type into a computer and type that in. What if I can voice what I'm doing? Number one, it would increase communication with the patient. It's never bad to share with, right?
Right.
Number two, I don't need to spend the administrative time doing what I'm doing because the ambient technology is capturing that, right? And then number three, I could be holding your hand while I'm doing it, right? So, you know what, ma'am, right now I'm just checking your vitals and we're seeing how you're doing. Okay, you're give your readings, give your technology, but now let me add something else into that. What if those vitals are touchless and wireless and you don't have a blood pressure cuff on you or an oxygen sensor on your finger or these various things because it's touchless. And now you're in this room. Now think of, well, maybe you don't need to be here because we could have that above your bed in your apartment or your house, the house you've lived in for 50 years and you're comfortable in and your family knows everything about and knows where the hidden key is to come in and check on you, which I would joke because my daughter would say, hidden key? What are you talking about? Just use your phone to open the door, Dad. But think about how all this weaves together. That's transformation.
It is.
That's transformation, not the fact that you come here, you come in, you come out, and that's transactional, right? Like we were talking on the break about, small surgical procedures that used to be hospital stays, and now, right, you get your shoulder fixed in your home in 6 hours. So that was transformational for surgery, right? But it's become a transactional event. You come in, you have a transaction, and you go home. So surgeries that have things that may require a balance pad, right? Or somebody who's older on cognitive things that may need to be checked after maybe a neurological type surgery, something of that nature, and they need to be checked. But do we have to come in for that? Can we monitor your vitals at home? Could you remotely check in? Could we use a type of a modern telemedicine visit to do that visit so that you don't have to have your daughter come pick you up, drive you to the medical facility to have, a 5-minute consult that takes 2 hours, right? When you include travel time and all things go with it. So I want us to be transforming care, and that transformation of care starts in the community. There may be a middle pivot spot of a hospital facility, could be a surgical center, could be a hospital facility, and then the home, right? This is transformation in the whole.
I love it. Absolutely love it. And some of the stuff we're doing within my own company is along those same lines. I mean, workflow, anything that is repetitive tasks, redundant tasks, we have machines doing today. And I use that terminology you use exactly. I talk about transactional versus relational. And I think you have got it. HonorHealth has got it. I mean, we're in the people business. We need to be more relational. We need to be there for them, not our head down typing away or writing away and not really listening to make sure we capture all that stuff, because we have all this ambient technology that can do this for us. And I love the stuff that you're doing on the monitoring. And I got to tell you, we talked about this in between the break. Definitely having you back after I get this tour. I'm so excited to see this. It'll be like a kid in a candy store just seeing all the stuff that you're doing, because I'm in a silo doing some of the stuff, but I mean, I know you're going to open my eyes, and certainly today I know you've opened up our listeners' eyes in the stuff that you are doing ever at HonorHealth.
Yeah, and we're just scratching the surface. When you come visit, it'll be fantastic. I mean, things that aren't really fun and sexy to talk about, like toilets.
No.
But the reality is, do you know how much that can tell you about your health?
100%, especially, urine output. I
right.
mean,
so
that alone.
Volume.
Yeah.
Volume, clarity, whether or not you have C. diff or whether or not you would have an infection or thing. We have these at the lab. You'll see them. We have smart toilets that will tell you that. So that's what I was bringing up, is you could have your mother say at her home and know, okay, you didn't open the fridge and get your medicine today. Your volume of urine is incredibly low. I'm worried that you're dehydrated. You didn't take your medicine, right? And all of these are back to your conversation with Todd Laporte of how do we save money in healthcare, and that might be
keep people out of the hospital.
Right. That might be a medical visit that we could track and see coming through technology and help. So now let's do the reverse. If you are that, 55-year-old person taking care of your 85-year-old mother, and you're on these technology, whether it's remote patient monitoring, whether it's a smart toilet, whether it's the fridge sensor, knowing they've opened all that, and all of it's going great, how much peace of mind does that now give you in your workday?
So, and you started the show talking about how, we have a lot of people out there, and you mentioned your wife as well, is that are caring for an older adult and also caring for their kids and trying to hold down a job. These are really hard things to do, and how much work time is being lost because that adult child needs to accompany the parent, whether it be for a doctor's appointment, maybe chemotherapy, or whatever that appointment is, where we can now save that person time because we can monitor them. I use these words, and I know I shared with you that we're using a technology in the home right now to keep people safe, and the words I use is predict and protect. Mm-hmm. And a lot of these innovations that you're talking about that are transforming the way we deliver care are predicting events before they happen. And here you're talking about monitoring the home, and one of the things we're able to do is if we see somebody, and AI is fascinating because AI will give you a baseline of activity that typically happens in the home, and then when the anomalies happen, that's when you get the alerts. But one of the anomalies that happens to us with this technology that we're using today called Sensi is that it can detect how many times they get up for going to the bathroom. Mm-hmm. And you and I know if the frequency increases, now we're looking at a possible UTI.
Right.
So you hear the music. Todd, wow, it flies by. I'm going to get with Bill. We're going to have you back after I do the tour. And when I do the tour, you'll probably have all these new gadgets and toys that we haven't even started talking about because I'm sure you're seeing a lot of that innovation today. Todd Larson, it's been really great to reconnect with you, and really what a pleasure it is to sit down and talk about what the future is going to look like.
Thank you. Thank you very much for having us here.
You bet. Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.